Tuberculosis, TB, is a contagious and often severe airborne disease caused by infection with Mycobacterium tuberculosis, MTB, bacteria. TB usually affects the lungs, but can also affect other parts of the body. When TB occurs outside of the lungs, the symptoms can vary accordingly. Without treatment, TB can spread to other parts of the body through the bloodstream. A total of 1.5 million people died from TB in 2020. Including 214,000 people with HIV. Worldwide, TB is the 13th leading cause of death and the second leading infectious killer after COVID-19, above HIV/AIDS. The Bacillus Calmette-Guerin (BCG) vaccine has had success in preventing tuberculosis. Chest X-ray, multiple sputum cultures for acid-fast bacilli, tuberculin skin tests, interferon gamma-release assays, IGRAs, are the most common diagnostic method. And do you know the two types of tuberculosis? The first one is active tuberculosis infection. Active tuberculosis occurs when Mycobacterium tuberculosis multiplies and causes symptomatic disease. Individuals with active TB often experience general symptoms such as unexplained weight loss, fever, fatigue, loss of appetite, and night sweats. The infection primarily affects the lungs, leading to persistent cough, chest pain, and coughing up blood. However, active TB can also affect other organs, including the kidneys, bones, and brain. Active tuberculosis is highly contagious and can spread through respiratory droplets when an infected person coughs, sneezes, or talks. It's important to note that not all people with active TB are immediately contagious. Infectiousness depends on various factors, such as the extent of lung involvement and the presence of a cough. Then it comes to latent tuberculosis infection, LTBI. Latent tuberculosis infection occurs when a person is infected with Mycobacterium tuberculosis, but the bacteria remain inactive in the body. Individuals with LTBI do not show symptoms and are not contagious. LTBI is diagnosed through skin or blood tests, which indicate exposure to the tuberculosis bacteria. While LTBI patients do not feel ill or spread the infection, they are at risk of developing active tuberculosis in the future. The risk of LTBI progressing to active disease varies depending on factors like age, immune status, and other underlying medical conditions. People with weakened immune systems, such as those living with HIV/AIDS or on immunosuppressive medications, are at a higher risk of reactivating LTBI.